Most pregnancies turned out to be more complicated as time went by and women were having their babies later in life. Issues that we never really thought too much about became much more prevalent due to that. We before didn't have any means of assessing what was going on inside during a pregnancy. Ultrasound was developed in the early 70s and allowed for the first time a way to objectively look at the progress of a pregnancy, the health of a fetus, the development of a fetus, any issues that might affect the progress of the pregnancy and a normal outcome. That was never able to be done before.
If you think about it, ultrasound, it's relatively new with regard to medicine.
The resolution of the ultrasound has increased dramatically.
The imaging got clearer and clearer.
There were a lot of different things that we used to do in the past that were invasive type procedures, and now with a lot of the new technology, specifically with ultrasound, we're able to diagnose different type problems without having to invade the intrauterine environment.
We have the 3D sonography, which allows the patient to have more bonding with a pregnancy.
Going forward in time, there'll even be more things that are going to be done in fetal therapy and intervention.
I could see someday where you have a hologram of the baby and you kind of turn it around out in space or on the machine.
There's research going on at every level. We do a great job here at Georgia Perinatal. Every day we're learning new and better ways to help treat our patients.
The next stage in our field will be genetics.
There's a lot of things now that we can diagnose and understand just by sometimes doing a simple blood test.
Now we have blood tests that can identify DNA of the fetus in the maternal blood and provide us with a 99% detection rate for Down syndrome, and that was unheard of when I was doing my residency.
The DNA that you inherit from your parents, that's your genetic blueprint. But how that blueprint is actually read and executed is a direct byproduct of the environment in which it's read.
That is going to be the next stage of our field. It's going to be major genetic advances.
I used to tell patients 5 years ago that some of the changes that we have right now were going to take 10, 20 years or more, and here we are. So what will we be able to do with technology in another 10 years? It's only a guess.